Hey, good morning, everyone.
Morning.
Are there any questions before we begin today?
I just have a question about the lab. Which one is the one that is gonna be for the test?
I think it's lab 5 through 9.
Through 9?
Yeah, there's a study guide for that as well on Canvas. Have you seen that?
No.
Yeah, it's under modules. If you scroll down, there's a study guide for that. I'll show you that tomorrow.
Okay, thank you.
Yeah. Okay, so today we're going to be talking about the skeletal system. So your learning outcomes are to state the functions of the skeletal system, describe the structure of a long bone and list the types of tissues it contains, list the 3 types of cartilage found in the body and provide a function for each. So the skeletal system consists of 2 types of connective tissue, bone and cartilage. Ligaments are formed of fibrous connective tissue join the bones. So the function of the skeleton is to support the body. It works with the muscular system, moves the body. It's used for protection. The skull protects the brain, the rib cage protects the heart and lungs, and the vertebrae protect the spinal cord. They produce blood cells, and they store minerals such as calcium and phosphate and fat. So anatomy of a long bone, we have diaphysis, the shaft of the bone. The medullary cavity is inside the diaphysis. Its walls are made of compact bone. The medullary cavity is lined with endosteum and is filled with yellow bone marrow, which stores fat. And the epiphysis is expanded end of the long bone, composed of spongy bone that contains red bone marrow where blood cells are made. Okay, so that's shown here. So the epiphyses, the metaphyses, and the diaphyses. So the epiphyses are coated with a thin layer of hyaline cartilage, which is also called articular cartilage because it occurs at a joint. The metaphyses is between the epiphyses and the diaphyses. It contains the epiphyseal plate, a region of cartilage that allows for bone growth. The peristoneum, connective tissue covering all bones, continuous with ligaments and tendons. So bones, there are 2 types of bone tissue, compact and spongy. Compact bone is highly organized and composed of tubular units called osteons. Osteocytes are bone cells. They lie in lacuna, tiny chambers arranged in concentric circles around a central canal. The matrix fills the space between the rows of lacuna. So tiny canals called canaliculi connect the lacuna with one another and with the central canal. Osteocytes stay in contact with each other in the caniculi. They exchange nutrients and waste through gap junctions that connect adjacent osteocytes. So spongy bones contain numerous thin plates called trabeculae. Although lighter than compact bone, spongy bone is still designed for strength. So red bone marrow is in the spaces of spongy bone, produces all types of blood cells. Osteocytes of spongy bone are regularly placed within the trabeculae. So cartilage is not as strong as bone, but it's more flexible. So the matrix contains collagen and elastic fibers. Chondrocytes are the cartilage cells that lie within the lacuna. Has no nerves or blood vessels, relies on neighboring tissues for nutrient and waste exchange. That makes it slow to heal. And there are 3 types of cartilage. We have hyaline, fibrocartilage, and elastic cartilage. So hyaline cartilage is at the ends of loose bones or long bones, nose, ends of ribs, larynx, and trachea. Fibrocartilage is the disc between vertebrae and in the knee. Elastic cartilage is the ear flaps and the epiglottis. So fibrous connective tissue made of rows of fibroblasts separated by bundles of collagenous fibers make up ligaments and tendons. Ligaments connect bone to bone. Tendons connect muscle to bone at a joint, also called an articulation. So bones of the axial skeleton. So your learning outcomes here are to identify the bones of the skull, hyoid, vertebral column, and rib cage. Identify the regions of the vertebral column and explain the function of the sinuses and intervertebral discs in relation to the axial skeleton. So the axial skeleton contains 206 bones. and are classified as axial or appendicular. Sorry, there's 206 total bones and are classified as axial or appendicular skeleton. So the axial skeleton is the midline of the body, consists of the skull, hyoid bone, vertebral column, and the rib cage. So that's shown here. So the axial and appendicular skeletons. So the axial skeleton, which is the skull, the rib cage, and things like that. So the skull formed by the cranium and the facial bones. So the cranium contains and protects the brain. In adults, it's made of 8 bones. In newborn, cranial bones are joined by membranous fontanelles, usually closed by the age of 16 months. So the cranium, the bones are frontal, parietal, occipital, temporal, sphenoid, and ethmoid. And the foramen magnum is a hole in the occipital bone through which the spinal cord passes. And then there's the external auditory canal in each temporal bone, which leads to the middle ear. And the sphenoid completes the sides of the skull and contributes to forming the orbits or the eye sockets. And the ethmoid bone also helps form the orbits and the nasal septum. So that's shown here. So here's the bones of the skull, the styloid process, the external auditory canal, the occipital bone, the parietal bone, the frontal bone, the sphenoid bone, nasal bone, ethmoid, lacrimal, temporal, zygomatic, maxilla, and mandible. And that's shown here from a different angle. Again, the bones of the face. So we have the frontal bone, the temporal bone, nasal bone, zygomatic bone, maxilla, and mandible. So the skull, the sinuses are air spaces in some cranial bones. They're lined with mucous membrane. They reduce the weight of the skull. They give a resonant sound to the voice. Are named according to the bones in which they are located. So frontal, sphenoid, ethmoid, and maxillary. A smaller set of sinuses called the mastoid sinuses drain into the middle ear. And so mastoiditis is inflammation of these sinuses. So the facial bones, the mandible, the maxillae, the zygomatic bones and nasal bones. The mandible is the only movable bone in the skull. The maxillae form the upper jaw and a portion of the orbits. The hard palate and the floor of the nose are formed by the maxillae, joined by the palatine bones. The zygomatic bones form the cheekbones. So mandible, maxillae, zygomatic bones, and nasal bones continued. The nasal bones form the bridge of the nose. Other bones, that is ethmoid and vomer, are part of the nasal septum, which divide the interior of the nose into 2 nasal cavities. The lacrimal bone contains the opening for the nasolacrimal canal, which drains tears from the eyes to the nose. The hyoid bone is not part of the skull, but is part of the axial skeleton. Is the only bone in the body that does not articulate with another bone. The hyoid bone anchors the tongue and serves as a site for the attachment of muscles associated with swallowing. In cases of suspicious death, a fractured hyoid is a strong indication of mandible strangulation. So that's shown here where the hyoid bone is. So the vertebral column consists of 33 vertebrae. There are 4 curvatures that provide more strength for an upright posture than a straight column. We have scoliosis, which is abnormal sideways curvature of the spine. Kyphosis, which is abnormal posterior curvature, hunchback. And lordosis, which is abnormal anterior curvature or sway back. So the vertebral column continued. The vertebral canal is in the center of the column. The spinal cord passes through into vertebral foramina, or a hole on each side of the column. Spinal nerves travel through this. The spinal nerves control skeletal muscle contraction, among other things. If the spinal cord and or spinal nerves are injured, there can be paralysis or even death. Sponiosis process of the vertebra, the bony projections along the midline of the back. The transverse processes extend laterally. Both spinous and transverse processes serve as attachment sites for muscles. So types of vertebrae, there's the cervical vertebrae in the neck. So the atlas is the first cervical vertebrae, holds up the head. Movement permits the yes motion of the head. And then the axis, or the second cervical vertebrae, named because it rotates around the long axis of the body when we shake the head no. Okay, so the spinal cord is shown here. So we have 7 cervical vertebrae in the neck region, which form the cervical curvature. We have 12 thoracic vertebrae, which form the thoracic curvature. This is where the ribs attach. Then we have 5 lumbar vertebrae and smaller back form lumbar curvature. Then we have the sacrum, which 5 fused vertebrae in adult form the pelvic curvature. And then we have the coccyx, which are 4 fused vertebrae that form the tailbone. Okay, so the thoracic vertebrae, ribs, and sternum. We have the spinous process and the transverse process, and the vertebral canal as well. So the intervertebral discs are composed of fibrocartilage. They prevent the vertebrae from grinding. They absorb shock caused by movements such as running, jumping, and even walking. Allows the vertebrae to move as we bend forward, backward, and from side to side. So become weakened with age and can herniate and rupture. Pain results if a disc presses against the spinal cord and or spinal nerves. So the rib cage or the thoracic cage is composed of the thoracic vertebrae, the ribs and their associated cartilage, and the sternum is part of the axial skeleton, protects the heart and lungs, and swings outward and upward upon inspiration and downward and inward upon expiration. So here's the thoracic vertebrae, the ribs and the sternum. So we have the thoracic vertebrae, the manubrium, the sternum, the xiphoid processes, the ribs, costal cartilage, and then we have true ribs and false ribs, and the 2 floating ribs. So the ribs, there are 12 pairs, all connected directly to the thoracic vertebrae in the back. Each rib articulates with the body and transverse process of its corresponding thoracic vertebrae, curves outward and then forward and downward. The true ribs are ribs 1 to 7, which connect directly to the sternum by means of a long strip of hyaline cartilage called costal cartilage. And the false ribs are ribs 8 to 12. Their costal cartilage does not connect directly to the sternum. The floating ribs are ribs 11 and 12. They have no connection with the sternum at all. So the sternum or the breastbone, along with the ribs that helps protect the heart and lungs, is composed of 3 bones, the manubrium, the body, and the xiphoid process. The manubrium articulates with the clavicles. The manubrium joins with the body of the sternum at an angle. So counting the ribs is sometimes done to determine where the apex of the heart is located, usually between the 5th and 6th ribs. The xiphoid process serves as an attachment site for the diaphragm, which separates the thoracic cavity from the abdominal cavity. Okay, so we're going to end there today. Are there any questions? Okay, so next time we'll talk about bones of the appendicular skeleton, and I'll catch you guys later.
Thank you.